Hi, I'm Dr. DeFabio, and it's a great day to talk rehab, and we're going to continue our discussion about running injuries, and this is about shin pain. And shin pain in the front, shin pain in the back, lower leg pain, what is it? What is that pain? That's what we need to know, because what your pain is will drive significantly what treatment you need to get for it. So, when we say shin pain, we're going to talk about pain from the knee down to the ankle, obviously. Now, your shin bone is the bone right here in the front. On the front and outside is a whole group of muscles, all right? That's called your anterior compartment of the shin, okay? Up and through here, comes around, it's your anterior compartment. It pulls the foot up, and it also brings the big toe in, so it goes up and in. Those tendons come right down and through here, all right? So an irritation to this area could be an anterior compartment, or an anterior pain syndrome, or an anterior shin splint. They're all synonymous. Shin splints indicate that the muscles in this area are irritated and inflamed, and they're sore. It could be an acute injury like a tear. It could be more of a chronic injury like a fraying, like a tendinosis, where the tendon in through here starts to fray. Or it could be where the tendon attaches to the bone. One thing you need to understand is muscles don't attach to bones like this. Muscles attach to bones like this. So if the muscle is sore and inflamed and it attaches into a bone like this, that's why you're going to get bone pain. So shin splints, an inflammation of this anterior tibialis muscle, where it attaches to the bone, can give you real bone pain, but it's coming from the muscle, all right? Conversely, you could get a posterior shin pain, and that's going to be on the inside here, okay? So you have anterior shin pain, or an anterior medial stress, anterior stress syndrome, or you have a posterior, which is the muscles that run in through here. Here's the shin bone, they attach to it here, and this is your posterior compartment, and it's mostly your posterior tibialis muscle, although your plantar flexors, the muscles that flex your foot down, are in here as well. Same thing, this muscle can get irritated and it gives you real bone pain because it's coming from the muscle. Doesn't necessarily have to be the bone, but you can be getting bone pain. The other thing that might be happening is you might have a stress fracture, okay? You might actually have a stress fracture on the bone. That means because of all your running and other activities you may have been doing, the bone is starting to break down. Think of bone like a honeycomb. On the outside, you have a hard, contiguous, one piece of sheath, and on the inside, it's a honeycomb. And those little combs of the honey can crack and break. That's a stress fracture, and it can happen in any bone. When it starts to happen in your shin here, it will be painful, like a broken bone. The treatment of choice is rest. If you want to know if you really have a stress fracture, you'll need an MRI, okay? Stress fractures will be sore pretty much like any broken bone all the time. A stress reaction and inflammation of the anterior tibialis or the posterior tibialis muscles generally are just sore when you're using the muscle, and for a little while afterwards, you ice it down, it calms down, the next day you're okay. But pain that lingers is a problem. My runners, if you're a distance runner and you're having shin pain, we pretty much are going to pull the plug and get an MRI because we assume it's a stress fracture before we know otherwise. And again, an MRI is the test of choice. Stress fractures or stress reactions, because sometimes we don't see the stress fracture on the MRI. We just see a little swelling. We just see a little bit of increased activity in the bone. We call that a stress reaction. It's like a very early stress fracture or a small one where there's not a fracture line. If they're in the front of the shin, boy, you better shut down. That's not a good prognosis. If they're in the back of the shin, you still need to shut down, but you can walk around, you can do other weight-bearing activities. If it's in the front, a lot of times we get you really minimal or no weight-bearing because the bone can break forward, and we don't want that. So, shin pain is not all the same. Most of the time it's a strained muscle where it attaches to the bone in the front or in the back. This is posterior tibial syndrome or medial stress syndrome. This is anterior tibial syndrome or anterior stress syndrome. You can watch my videos on how we treat those. But if you are having shin pain, we always have to consider a stress fracture or a stress reaction in the bone, and it does need to be ruled out. If you have a history of any stress fractures, you are at more risk of having another one. It doesn't have to be in the same area, so FYI. A lot of information, not a lot of rehab this time, but we want you to be informed. Thank you very much. Hey, Mike, thanks for letting me write on you today. All right, appreciate it. I'm Dr. DeFabio. Watch the rest of the videos on shin pain, and we'll see you on the next video. And please share these with your friends and other athletes. Have a great day. Okay.
There's two.
Now we record.